We want to cover every child in America who's below 200% of poverty, period. If you're below 200% of poverty, and you're a child and your family doesn't have health insurance, and you're a legal resident or a citizen of the United States of America, we think you should be covered.
Healthcare coverage in America is a growing concern. To help expand healthcare coverage to uninsured, low-income children, the federal government mandated $40 billion to the State Children's Health Insurance Program, better known as S-CHIP, as part of the Social Security Act of 1997.
The Kentucky Children's Health Insurance Program, K-CHIP, was established in 1998. It is funded with federal and state dollars. The federal government contributes about 78% toward the cost of the program, while the state pays about 22% of the costs. The families are in the 200% poverty level and do not qualify for Medicaid. These children are in the gap.
K-CHIP's been wonderful for Kentucky because we have so many working poor in Kentucky, and prior to the State Children's Health Insurance Program, we had so many people who were working full-time but didn't make enough to afford insurance, so they and their children were uninsured.
You're making that choice between, let's hope that we don't get sick and not pay that $500 a month, or let's pay that but then nobody gets any new clothes and we're going to eat beans and tacos every night.
So it's been a real key part of making sure that working families have the kinds of means that they need to make their families safe and secure and healthy and strong.
Recently, President Bush vetoed a bill to reissue the S-CHIP program. It would have expanded the program to cover 10 million children. The bill would also have increased spending on the S-CHIP program by $35 billion, bringing the total to $60 billion over the next 5 years. In the House, the bill fell short of overriding the president's veto by only 13 votes.
Experts have many different opinions on why the bill was vetoed.
So it is very expensive.
I think it was unclear about who exactly it was going to help. What the question is, the key question is, how broadly do we want to cover people, and to what income level? And those are choices about how to ration our public dollars. And I think there's a spectrum of there, but this is one of those. I think it's a growing concern in our country that there are so many families that are uninsured. And at least to be able to cover the children, I think people understand that as an important societal value. And
the President says, well, that would cause problems with the insurance companies.
As a result of having insurance, somebody pays for everything. You know what people do? They come in the office with every little sniffle and fever. Where we used to never do that growing up. Never did. My parents took me when I was sick and needed a doctor, not just to go be seen because somebody else is paying for it.
It's the whole Republican-Democrat thing. Yeah. The Democrats want to cover more people and have more social programs and stuff, and the Republicans say we don't need to do that, and it costs too much money. And there's probably, they're in Medicaid and all the federal programs, there's probably waste, and they say that, and it's not set up right, and all that. But in the end, the children get the care from the ER, and they don't get care anywhere else.
It was because of the tobacco tax funding.
It was proposed that a 61-cent tax increase on cigarettes would fund the new bill. Both smokers and cigarette companies alike were outraged.
There were a lot of folks and many members of the Kentucky congressional delegation that were against raising the tobacco tax for that. And there were some people that philosophically say we should all pay for that program, not just people who smoke. I think it's a very logical tax. We know we've pretty much decided as a country that we want to try to eliminate smoking, and we know the impact on people's health as well as what we spend as a country on the bad outcomes of smoking. For Kentucky, because we have so many health problems related to smoking, the fewer number of people smoking in Kentucky helps us spend less money on health care. But they're very organized and they spend a lot of money.
Sometimes the problem isn't the program, it's getting people involved in it.
It's kind of a controversy right now in Kentucky because we feel like there are a lot of kids out there that we haven't reached.
In Kentucky there's 1 million children, and 150,000 of those are eligible for Medicaid or K-CHIP, but only 60,000 are enrolled. So there's a lot of kids out there who are eligible for one of the two, but they're not enrolled. So a lot of kids are walking out there without insurance, but there's a lot of barriers to enrollment.
K-CHIP first came about, the patients that even were eligible didn't know enough about it to go and fill it out.
Yeah, there's a lot of people out there who just can't get through the paperwork for whatever reason. They have to go certain places, they have to provide this documentation, and it hampers a lot of people from getting in.
But it's also letting people know that they're eligible for this benefit. And a lot of families may not know, they're sort of working class, they think I'm not, this is not, but when it comes to their kids, they're willing to do things. And if they knew that, this is something that our country has set aside to make sure that our kids at least have health insurance in this time when so much of our health system is broken and too many people are uninsured and have no recourse, I think many, many families would sign their kids up.
Though the specifics of funding are debated, it is generally recognized that S-CHIP is a beneficial program and has wide public support.
We made it better. We made it more in line with what this administration really wanted. The only apparent conflict is over the $35 billion on top of the $25 billion. But if you look at that, and if we're sincere, and if we really want to take care of children, then my gosh, CBO says it's going to take that much money to take care of the kids who are eligible for this program. So if we're truly compassionate, it seems to me, we'd want to endorse this program.
This is something that really is flies in the face of what is very popular with the public. And you see 70–80% of people that are polled say, yes, I want my money, my tax dollars to go to keep kids healthy. But the politicians are not listening.
But it's coming. They might as well get ready for it, because this country cannot support a continual 18–20% increase in healthcare costs and everything. Cannot do it. No country can survive that.
I think most people feel that having access to health insurance in some way in health care is something that we should all have. And they may not realize that there are just so many working families that are making choices not to insure their families. And they may be eligible for this benefit and they need to get it.
If you start giving kids good health care earlier, you prevent a lot of chronic diseases later on in their lives. So it really is good, well spent money, a good investment for states and the federal government.
Children are our future. We've got to make sure that they have the preventive care. It saves us much money down the road in disease prevention and immunizing, helping them get on track for proper nutrition, and doctors will talk to them about the importance of exercise. It's just it makes sense to put money in prevention as opposed to trying to fix things after they're already out of whack.
The healthier your population is, and the better off everybody is. As you know, because you got a healthy population, they don't need the advanced technology that we got out there for medicine, stuff like that.
If a patient knows they have an insurance coverage, whether it's private insurance or it's publicly provided via the S-CHIP or the K-CHIP or regular Medicaid, they're more apt to get the care that they need when they need the care.
The bottom line is, by the end of the year, we need to make sure that S-CHIP is reauthorized.
It makes sense. It's prevention.
I says anybody takes kids, someone's going to lose.
I think a lot of people think, well, my kids aren't going to get that. But you have to think about the fact that your child may be sitting next to someone who's not getting health care. And what if they get sick? It affects all of us.